Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started.
Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. Today, we are going to be talking all about growth plate injuries in dancers. So a lot of the dancers that I work with in the clinic and a lot of the dancers that you probably teach in the studio, or if you're a dance parent, your dancers are probably adolescent dancers or dancers who are still growing. We often classify these dancers as skeletally immature. So their skeleton has not yet fully matured. It's not yet finished growing. And so these are the dancers that are going to be affected by potential growth plate issues. So these are kind of a set of conditions that are unique to kids who are still growing. So we don't see these issues happening in an adult population. So if you only work with adult dancers or you are an adult dancer or things like that, this episode really probably doesn't pertain to you. But anybody who works with dancers that are children or adolescents and anyone who is still growing, this is a really, really important topic to understand, because this is one of the things that makes working with that population a little bit unique. I think it's easy for us to sometimes just assume that children and adolescent dancers are just like small adults, but realistically they are not. There's some pretty significant differences and things we need to be aware of when we're training them. And this, as we kind of talk through growth plate injuries, this is going to be apparent. But one of the things I think we need to be aware of is, as the skill level of dancers is increasing, like what young dancers can do nowadays is miles beyond what they did, 10, 20, 30 years ago in terms of difficulty and skill level and things like that. And although it is amazing to see the level of skill and talent that some of these dancers have, we do need to be careful about how we're pushing these dancers and sort of what kind of boundaries we're setting for these dancers because of things like the potential for growth plate injuries, which don't exist in a kind of more adult or mature population where their skeleton is finished growing and bones are fully formed and fully fused. We're not going to have the same potential for injury. So it's important to understand what growth plate injuries are, how they occur, and how they affect dancers, because like I said, as we see this like advancement in skill level, this is maybe where we sometimes see some of these issues kind of crop up. So before we get into the specifics of growth plate injuries and what types of growth plate injuries we see, I think it's important that everybody kind of have an understanding of what a growth plate actually is. So I think most people are probably familiar with that term. I think it gets thrown around a little bit, but I don't know that people actually know or understand what exactly is a growth plate. Is it a plate? What does it look like? Those types of things. So we're going to do a little tiny anatomy review just to start with, and then we'll talk about some common growth plate injuries that we see. So a growth plate, the technical term for it is a physis, so P-H-Y-S-I-S, or it'll often be called the epiphyseal plate, is kind of the more technical term for it. But essentially, it is made up of cartilage, specifically hyaline cartilage, but these growth plates are cartilage cells, so they're not actually bone cells at this point in time, and they occur at the ends of the long bones in the body. So our shin bone, our thigh bone, our arm bone, any long bone in the body, hands, feet, anywhere, we have these growth plates. And the growth plates are what allows for those bones to grow longer in length as, in this case, dancers, but just children in general, are continuing to grow. So we have the shaft of the bone, and then at the either end of the bone, we have these growth plates, and that's how we add length to bones as dancers or kids are growing. So like I said, these growth plates are actually cartilaginous. So they're made up of cartilage cells. So they're a tiny bit different than like the shaft of the bone or what we typically think of as bone, which is a little bit different and not made up of cartilage cells in the same way. These growth plates are active at various points throughout kind of growth in kids and adolescents. So we have growth plates in every long bone in our body, and we may have growth plates that are more active in, let's just say, like our thigh bone at any given period of time. Those ones might be really active, and we might have growth that's occurring in those bones, but we might not have a whole lot of growth that's occurring in, say, the feet at that same time. And so then the growth plates in the thigh bone might become a little bit more inactive, and the ones in the arm might become more active. So they kind of go through cycles over the course of years. It's not as if these are always in like, full active mode or fully kind of non-active mode, if that makes sense. So we will see these cycles, and this is why we get what we kind of quote unquote call growth spurts in kids, where it'll seem like, oh, they haven't grown in a while, and then all of a sudden they like kind of shoot up. And that's because of this kind of cyclical nature of when these zones of growth become more active in various points in the body. These growth plates then, as we reach later stages of adolescent, will actually, what we use the term like kind of close. And so what happens is these growth plates actually like kind of ossify and they become non-active. And that's when growth stops. And so then we no longer have growth that's happening in the long bones. So that's when we have a kid or a dancer who is reaching their kind of skeletal maturity, or, they're as tall as they're going to get, or their feet are as long as they're going to get, or things like that. That happens at different points for different people. We talked a little bit about this when we talked about the adolescent growth spurt. So if you have not listened to that episode yet, I will link that episode in the show notes. So that episode just talks a little bit more about what specifically happens physically around the adolescent growth spurt. But in that episode, we talk about how that growth spurt tends to happen earlier in females and slightly later in males. And so the same is true for these growth plates, because those growth spurts are being kind of regulated, it's not the right word, but are happening through the growth happening in these growth plates. We see the closure of these growth plates happen earlier in females generally than in males. And usually the closure of these growth plates is going to happen about 2 years after that kind of adolescent growth spurt that happens, around the ages of potentially 13 to 15, or again, it's a little bit different for males and females. That being said, different growth plates close at different times. So we have some growth plates that are more active earlier in life. So we have some that kind of peak more in younger years, like maybe like 9 to 11 years old. And so they're going to close earlier than growth plates that might peak in activity later around 13 or 14. And those ones will close later. So not every growth plate in the body closes at the same time. And there can be ones that close much later in life. Our growth plates that close, this would be like maybe more so in males and more so in people that grow a little bit later. So maybe they go through their adolescent growth spurt a little bit later, but we can potentially have growth plates that don't close fully until like 20 or 21 years old. So we need to keep that in mind and remember that a lot of our dancers, although they may have finished kind of growing or seemingly finished growing around 13 or 14, and you're like, okay, I think you're probably about as tall as you're going to get, they still have growth plates that are going to be active for a couple of years after that. And so we need to keep that in mind when we're thinking about things like training load and how much we're stressing their skeleton or their body because of those growth plates still being kind of active and open. They haven't fully closed yet. Once those growth plates close, then we're at a little bit less risk for these growth plate type injuries in through there. The reason we care so much about growth plates is because they actually are basically the weakest area in the skeleton. So they are weaker than the other tissues that surround that area. So they have like ligaments and tendons and things like that attach into those areas of the bone. Like that's how things connect to our skeletal system, is by attachments from ligaments and tendons. But the growth plates are weaker than those other structures that are attaching in. So if we have force going through those areas, and that can be a repetitive force that's happening like repetitively over time, or it could be a more traumatic force like a fall or something like that, The growth plate, because it's the weakest area, is the most susceptible to injury. So we want to make sure that, especially in the case of these overuse type things, we're really trying to protect the growth plate as much as we can. Because if we have injuries that happen to the growth plate itself and they're not addressed adequately, we can actually disrupt the growth in that bone. And so we could end up sort of prematurely ending growth in that bone, which can become problematic if it hasn't reached its full length or it's sort of like its full amount of growth that we expect in that. We also know that these growth plates during times of growth spurt, so when those growth plates are more metabolically active, they're going to be even more prone to injury or more susceptible to being injured. And there's no way for us to sort of know when a specific growth plate is the most active. Like, we can't be like, oh, the growth plate in your shin is active right now, and therefore we want to make sure that we kind of protect that area specifically. We have no way of knowing which growth plates are most active at any given time in the average dancer, but we need to be aware of the fact that those growth plates are weaker and more susceptible to injury, and especially during periods of growth. So although we don't know specifically which growth plates are active at any given time, we do often know if dancers are going through a bit of a period of growth. And we talk about that lots on the episode about adolescent growth spurt and things we can do during that time to mitigate or minimize the risk of sustaining injuries as things are so rapidly changing in the body during that time. So one of the injuries that we see commonly in growth plates, or one of the most common growth plate injuries that we see, is actually growth plate fractures. So as I kind of alluded to earlier, these can happen from a traumatic event. So the same as we fracture a bone, we have a fall, we twist an ankle, things like that, and we have a traumatic fracture. That fracture could happen sort of like mid-shaft in a bone and therefore not affect a growth plate. But because growth plates are generally weaker than a lot of the surrounding tissues, there is a higher likelihood of that injury occurring at a growth plate area. So about 15% of fractures in kids and adolescents, and this isn't a dance-specific stat, just kind of in general, about 15% of fractures in kids involve the growth plate area of the bone, and then the other percentage, involve more like mid-shaft or things like that. So just when we have a traumatic fracture, it's important for us to know and understand whether it is affecting the growth plate or not. That will ideally be recognized by whoever it is who's diagnosing the fracture. So most of the time what's happening is the dancer's going to the hospital, usually the emergency department. They're getting an x-ray, to identify whether they have a fracture or not. And they should be flagging that at that point in time, that like this looks like it's affecting the growth plate. If you are lucky enough to live in an area that has pediatric-specific hospitals, this is one of the advantages of going to like an emergency department or a hospital that specializes in working with kids and teenagers, is they are automatically going to be like super, super on the ball about detecting these types of injuries. I know that that is not always the case, and especially if you're from sort of a smaller area and maybe you don't have as much access to kind of like specialized care and that sort of thing, so you might be going to a more generic emergency department. So it's definitely worth asking, especially if a fracture is happening where it looks like it's closer to like the end of a bone, because those are where the growth plates are, and just kind of raising that flag if it seems like maybe the medical professional looking at the imaging maybe doesn't see kids a whole lot. Totally worth asking just that question of, hey, does it look like that's affecting their growth plate at all? And they're just going to say yes or no, but it might trigger them to like look closer at that if it's something that they have not considered, at first glance at those x-rays. So I will say that the medical professionals are kind of trained to pick up on that, and they should pick up on that. But I've definitely had cases where they have been missed because they've been seen by maybe a little bit more of a generalist and not somebody who's so used to looking at kids or like more skeletally immature kind of imaging. So just something to be on your radar. It should be flagged by the medical professionals. But again, if you suspect that it is a dancer or like you have a dancer, if you're a parent, it's always worth asking the question just so you fully understand what is happening in the management of that fracture. So like I said, we can have fractures of the growth plate that are traumatic in nature. And then we can have fractures of the growth plate that are actually just related to chronic overuse or like repetitive overuse injuries. These are really common in, I think they got like a lot of kind of publicity and press with throwing in like little leaguers, like baseball players and softball players. And the growth plate at the elbow specifically is one that we would see lots of growth plate kind of fractures, or they're almost like stress fractures, but occurring at the growth plate from this repetitive overuse. And that is actually why there are pitch counts in baseball. And so as you go through the ranks of like little league, they have really strict numbers of like times that pitchers are allowed to throw the ball. And so, they have pitch counts that are cumulative over the course of like a week, basically. So they don't want to be overloading these athletes because there was such a high incidence of these growth plate injuries in young little leaguers sort of throughout the years. And so they, as an organization, like the governing bodies came in and said, okay, what can we do about this? And they've actually implemented like pitch counts so that they are hopefully avoiding overstressing these areas. We obviously don't have anything like that in the dance industry in terms of like regulating load and overload and things like that. And we don't commonly see the upper extremity growth plate injury so much in dancers, but certainly with lower extremity growth plate issues, it is something to consider. I mean, we're never going to get to the point where we actually have strict limits on, how many times a dancer is allowed to land from a jump or things like that. But we just need to be aware of the fact that if we're really overloading these dancers, and especially with high impact type things, so as tumbling and acrobatics becomes more popular in the dance world and is being incorporated into dance more often, we need to be aware of like how many really hard landings or like high impact, high velocity landings is a dancer doing in a session. I see these issues commonly as dancers are trying to like master a skill. So they're trying to like master, say, their aerial. So they're just doing it over and over and over and over and over and over and over again. And then they end up coming in with like, issues with like the growth plate in their heel or something like that from those really hard repetitive landings. So again, I don't think we'll ever get to the point where we actually have strict limits on this like they do in baseball with like pitch counts, but it is something for us to consider that when we are teaching new skills or when we are doing things that are that high velocity, high impact, we need to be really aware of like the impact that that's having specifically on the growth plates in dancers. These growth plate fractures generally do well healing wise as long as they are managed appropriately. So if we miss these in terms of diagnosis, then like I said, we can actually have like disruption of that growth plate and we can have premature closure that's happening, which is problematic because then that bone will stop growing earlier than it is supposed to. But as long as these injuries are managed appropriately and in like a timely fashion, so diagnosis is like key with these, then generally they do have like quite good recovery outcomes. So, in a case of an acute fracture, that is a little bit easier to manage. Usually you've gone to the hospital, gotten an x-ray, it's clear that there's a fracture, and so they're either going to be casted or splinted or whatever, and management is probably pretty straightforward. But sometimes in these more overuse type injuries, we don't identify them or they maybe don't get diagnosed as early. And some of that is because dancers will sometimes kind of just push through and continue, dancing through these injuries and that type of thing. And sometimes it's because they can be a little bit hard to differentiate from other types of injuries. So we just want to make sure that they are on our radar. So if a dancer comes in with something that, maybe is presenting a little bit like it could be kind of like stress fracture-ish in nature or things like that, we want it to be on our radar, especially if you're a clinician, that like, okay, could this be impacting the growth plate? Do we need to make sure that we're managing this and managing their load appropriately, that we're not disrupting growth in that growth plate or those types of things? So growth plate fractures are one of the really common injuries that we see with growth plates. The second kind of category of injuries, and these actually I probably see more commonly in dancers than the true fractures, are what is called an apophysitis. So the apophysis, so remember the growth plate, the like correct terminology for growth plate was like the physis, I can't even say that word, or the epiphyseal plate. The apophysis, so APO and then PHYSIS, the apophysis is the area of the growth plate where the tendons and ligaments attach to the bone. And so it's like that attachment site. So again, it's usually kind of at the ends of bones or like where we call them like tubercles a lot of the time, but there'll be little like bumpy areas where ligaments and tendons attach into the bone. Those are our apophysis. Apophysitis, so anytime we add itis to the end of a word to have an apophysitis, that is an indication that there is inflammation that is occurring in that area. So an apophysitis is an inflammation of the growth plate where the tendons and ligaments attach into this area. There's some really common locations or common areas that we see in dancers, but also in other athletic populations, because these growth plate issues are most commonly seen in really active and athletic kids. So they are almost always associated with overuse of the area. And remember before I was saying that the growth plates are weaker than the kind of like soft tissues like the tendons and the ligaments and those sort of things around it. And so what we often see in these like kind of athletic or kind of sporty populations of kids is that they get really strong. Their muscles get quite strong. Their tendons and ligaments are quite strong, but they're attaching into these areas that are still relatively weaker because the growth plates haven't closed yet. And so we can end up with inflammation in that area. They are more common in boys than in girls, but we see them really commonly in both genders. And like I said, generally in kind of athletic populations. So these are ones that we see fairly commonly in dancers. And I would say in my practice, at least more commonly than like true growth plate fractures, we see these apophysitis type injuries. So the most common ones that we see, like location-wise, and a lot of these ones have been named, and so you might be familiar with some of these names, but the growth plate that is in the calcaneus, so the heel, this gets called Sever's disease if we have an apophysitis, like that inflammation of that apophysis in the calcaneus. And so it's kind of the spot, well, it can happen in two locations. The more common one that we see is where the Achilles comes down and attaches into the back of the heel in through there. But the plantar fascia also attaches into the calcaneus as well. So it can be coming from kind of either area. And essentially what happens with these apophysitis, where we get this inflammation, is it's due to traction happening at that attachment site. So if we have that tendon, so let's just use the Achilles tendon as an example. So where the Achilles tendon comes down and attaches into the back of the ankle, if that tendon is stronger than that growth plate kind of attachment site, as we are putting force through the Achilles tendon, it's pulling on that attachment site or creating traction at that attachment site. And over time, that traction force can create that irritation and that inflammation in that area. So again, Sever's disease is probably the most common growth plate thing that I see in dancers. The second most common one that I see is called Osgood-Schlatter's, and this is the inflammation of the growth plate right at the tibial tubercle. So it's right at the front of the knee, but below the kneecap. There's like that little bump where a patellar tendon attaches in to the top of the tibia right below the knee, and that can become inflamed in that area. And so that's our like quad tendon basically attaching in, or the patellar tendon, but comes from our quadricep muscle. And so again, in sporting populations or athletic populations that are doing a lot of jumping and like using a lot of kind of quad type movement patterns. So we see it in basketball players and runners, but also in dancers a lot. We can get that inflammation happening in that area. So Osgood Schlatters is another one that's really, really common that we see. One of the other areas, I don't see it quite as much, but it does show up occasionally, is called what is it called? Island's disease. And it's the base of the fifth metatarsal. So our pinky toe, basically, it's along the outside border of the foot. There's a growth plate along the base of the fifth metatarsal there that we can get these kind of traction apophysitis injuries from. So again, I don't see it quite as commonly as the severs or the Osgood Schlatters, but it certainly happens. The muscles that come down the outside of your leg, your peroneal muscles, they attach into that area. And we actually do use those muscles quite a lot just from being in turnout in dance. And then also if you have dancers who are like kind of constantly winging their feet, that can put a little bit of like undue stress in that area. And so we can see these kind of develop as part of that. And then the other one that we see commonly in the dance population is the iliac crest. So that's kind of the pelvic bone, basically. And especially it can happen anywhere along the iliac crest because there's a bunch of different muscles that attach to different areas of it. But what I see most commonly is the ASIS, or anterior superior iliac spine. So that's kind of like the pointy part of the front of your hip bone. Like if you said put your hands on your hips, it's kind of where you would naturally your hand would sort of fall, and there's like that little kind of pointy front edge. We have muscles, hip flexor, rectus femoris muscles that attach into that area, and we can get sort of that same apophysitis happening from that area in through there as well. So those are probably the most common locations. In general, like not in a dancing population, but just in a general population, they're actually quite common in the upper extremity. So again, in throwing athletes or weight-bearing athletes, there's, one in the wrist, one in the elbow, one in the shoulder that are all common sites that we see them in as well. But I don't see those ones as commonly in dancers. Again, as we see more tumbling and kind of like impact through the upper extremity happen in the dance world, we may start to see those ones happen more. They are quite common in gymnasts, especially the one in the wrist. But so far in my practice, I haven't observed a lot of the upper extremity. It's mostly been those lower extremity ones that we see. With these types of injuries or these kind of processes that happen, one of the hallmark signs of them in terms of like us diagnosing is they will always be really, really tender on palpation. So if we press like directly on the growth plate, they will be really tender like in that area. And it's one of the kind of like hallmark signs of it being like a growth plate issue as opposed to, like a tendon issue or a muscle strain or things like that. We can also have pain when we activate the muscles that attach into, or the tendons that attach into those areas. But that tenderness on palpation is one of the kind of like hallmark signs that we see that indicates like, okay, this is probably a growth plate thing that's going on in through here. With these, in terms of management, or what do we do about them when we have dancers who are dealing with these, they are dealt with entirely by kind of symptom management, basically. So we want to decrease activity to the point where we can decrease their symptoms. So we basically say, like, they can participate in activity within tolerance, or like kind of within, we will often say pain-free tolerance, but at the beginning they may not be like pain-free, but we don't want to be like irritating things or aggravating things further in through there. They used to do a lot of like immobilization for these types of things. So back in the day, they used to actually like put, especially for the Osgood Schlatter, like the one at the knee, they actually used to put people in like a straight leg cast for a period of time, like 4 to 6 weeks, where they would cast the leg so that they couldn't actually bend their knee. But we now know that we actually don't see better results from doing that than from allowing people to like kind of use their quad muscle and move around and do activities within a certain amount of tolerance. But we do need to decrease the loading on the area so that we're not just continually irritating that kind of growth plate in through there. So it's very much activity modification in with regards to like symptom management. And then the really biggest thing that we want to do is try and decrease the amount of traction or the amount of pressure that is happening at that growth plate. And one of the best ways of doing that is making sure that we have adequate length in those muscles that attach into there. So if we are talking about, let's say, sever, so the back of the heel, like where that Achilles attaches in, if we are tight through the calf muscle or through the Achilles in that area, that's going to put even more pressure, or like it's going to create more traction that happens at that growth plate. So we can do things to try and really work on loosening up that muscle. And so working on stretching or myofascial release techniques. Sometimes we'll use like dry needling to loosen things up. So anything that we can do to make the muscles as loose as possible so that they are decreasing how much pulling is happening at the growth plate. So that's kind of the main goal of rehab at the beginning when people have like pain and symptoms there. And then sort of later on, once symptoms have settled down and it's no longer super painful, then we're looking at load management and loading that area appropriately so that we're not overloading the growth plate, but getting kind of appropriate and adequate loading through that area. The good news with these types of injuries with the apophysitis is they are self-limiting in nature, in the sense that once that growth plate closes, people won't have pain anymore because it's no longer going to be like metabolically active where it's creating that sort of like inflammatory process. So it's, one of those things that you can kind of tell people that like this isn't going to be an issue forever. However, depending on what age this issue is presenting, and generally they kind of crop up around adolescent growth spurt type ages, their growth plates might not actually be closing for a few more years. So we definitely want to work on management in the meantime because we don't want people like suffering for that amount of time. And if we don't modify activity loads at all and we just continue to keep stressing those kind of areas, we'll actually get changes in the bone structure. And I'm sure people have probably seen people walking around who have like really, really prominent bumps on the front of their knee, like where at that tibial tubercle. And those are often people that had Osgood-Schlatters when they were a kid. And you can actually see, and maybe they had it on one side or maybe they had it on both sides, but you can actually see that they'll have like permanent changes in the bone structure because the body, if you've listened to the podcast episode on stress fractures, we discussed this, but the body lays down bone in response to stress. And so we'll actually get kind of hypertrophy of the bone in that area if we don't modify the loading while this is going on. So although these are self-limiting in the long term, that once the growth plates are no longer metabolically active, these don't cause issues anymore. In the short term, we do need to really look at loading modifications so that we're not creating long-term issues in terms of like bone modeling and hypertrophy and things like that in the area. So the biggest thing with these in terms of management really is like load modification and symptom management. And so that's going to be really different depending on each dancer. And so sometimes when I have dancers who have these types of growth plate issues going on, it's a little bit hard in terms of communication with the studio because the studio often is like, okay, well, are they going to be able to do this competition that's happening in 3 weeks' time? And sometimes that's a hard question to answer because we don't know exactly what course these growth plate injuries sort of take sometimes. Sometimes they can be a bit cyclical in nature. So if that growth plate's really metabolically active at any given time, that dancer might have a lot more symptoms and be in a lot more pain. And then that growth plate could become like metabolically a lot less active. And they might be like, oh, it actually feels okay for like a couple of months, say. And then it might flare up again as that growth plate again goes through a more metabolically active stage. So it can kind of come in these cycles a little bit. So sometimes it is a little bit hard to predict exactly like how much or how little a dancer is going to be able to do at any given time. But we just have to be patient because we know that they will eventually resolve, and we just need to really look at load management and load modification in the meantime so that we're not, disrupting the growth plate processes and causing kind of longer lasting effects in those growth plates. So I think I'm going to wrap it up there. There's more I could say about growth plate injuries, but I always try and keep the episodes around half an hour long. So I will wrap things up. If you have any questions with regards to anything we talked about today with growth plates, please feel free to reach out. You can send me an email, reach out to me on social media. I always love to hear from you. I've had some really, really great questions coming in with the last few episodes, and it's always so nice to interact with people and to know that people are listening to the podcast. I think my main takeaway from today's podcast is, like I said, we cannot treat adolescent dancers just like small adults. We do need to take into consideration the fact that because they are still growing and because they are skeletally immature, we do need to make sure that we're really aware of that. So we're being extra cognizant of the load that we're placing on their bodies. And so if we are working with any dancers who fall into this category, we want to be really, really aware of the fact that their growth plates are going to be more vulnerable to injury. And so we need to look at how much load or what demand we are placing on their bodies to make sure that we are not leaving them susceptible to these growth plate type injuries. So if you enjoyed today's episode or found it helpful in terms of understanding a bit more in terms of growth plate injuries, I would encourage you to share the episode with somebody else who you know who either teaches adolescent dancers or has an adolescent dancer or maybe is an adolescent dancer, just to help spread the word, because I think a lot of people are maybe not necessarily aware of the potential for these injuries at growth plates in adolescent dancers. So that is my only request today, is potentially share this episode with somebody who you think could benefit from listening to it. So I'm going to wrap things up. Thank you so much for being here. I really appreciate your support, and I hope you have a great rest of your day.